Session 10 is our next session, and under this session we are going to look at foreign body in the ear and tumor of the ear. It seeks to introduce students to the management of foreign body in the ear, and it as well seeks to help students manage patients with ear tumors. The pathophysiology of tumors discussed in Nurs 234 should be reviewed to help understand the tumor of the ear. So the session outline is as follows. We look at definition, incidence, causes, signs and symptoms, and management. At the end of the session, students should be able to explain the characteristics of ear tumors, mention some diagnostic investigations for ear tumors, and identify immediate management of foreign body in the ear. Our first topic is foreign body in the ear. Foreign body in the ear, also known as oral foreign bodies, refer to the retention of materials in the auditory canal. The oral bodies of foreign bodies usually found include insects, and these include cockroaches, moths, flies, household ants, and we also have food particles such as seeds, beans, which are the commonest, and we may also have candy. Inorganic materials may include jewelry pieces, pencils, erasers, rocks, portions of hearing aids, and pieces of toys, children's toys. It is the foreign body in the ear is the commonest case presenting at ear, nose, and throat department as emergency cases, and children between 2 and 8 years are usually the victims as well as adults. Jewelry pieces are the oral foreign bodies found in children, whilst cotton pieces are the most common oral foreign bodies found in adults. And very old people with hearing aids also report with pieces of broken parts of the hearing aids. Earwax, however, is not regarded as a foreign body. The causes may include intentional placement of objects in the canal to relieve itchiness, wax and to clear or clean the ear canal, self-mutilation as in ear stuffing as part of psychiatric disorder. Insects may crawl into the ear canal during sleep, especially if one sleeps on the bare floor, and attention deficit hyperactivity in children, as well as other traditional remedies. The manifestations include, and it will depend on the type of objects. Smaller objects may go unnoticed, while bigger ones are noticed almost instantly. And how long the foreign body has been in the ear canal is also a factor, and whether a failed first attempt has been made to remove it or not. So clinical manifestations include foreign bodies of animate objects, which tend to feel very uncomfortable. With foreign bodies of animate objects, the individual feels uncomfortable. Insects may sting, while vegetables and other foodstuffs may absorb moisture through osmosis and then cause hearing loss. Vomiting as well as pain may also occur. And the foreign bodies of shorter duration tend to present less feeling of pain and discomfort, especially if a first attempt has not been made, as opposed to foreign bodies of longer duration with complicated first failed attempts. So individuals must be educated to avoid forcibly trying to remove some of these foreign body and advised to visit the ENT clinic or the hospital for removal. Then foreign bodies with delayed presentation cause erythema and swelling of the canal with foul-smelling discharge. And then the failed attempts to push the foreign bodies further into the external canal, sometimes extending as far as the middle ear. And these may also cause significant discomfort. There may be pain and discharge, which can be bloody. Perforation of the eardrum may result, and then there may be subsequent problem with balancing as well. Diagnostic investigations may include a detailed history from the patient and his or her relatives in the case of children or those with significant hearing loss, and then through physical examination of the ears and nose, then is usually the most useful procedure. X-ray, that is physical examination, is very useful in identifying these foreign bodies. The use of otoscopes in examining the patient's ear may help to identify any foreign bodies in the ear canal. X-rays of the head may also be done. Then the treatments include removal of foreign body by any of the following methods. Mechanical extraction may be done. Ear syringing or irrigation may also be done. Then suctioning may be done. Magnetic extraction may also be done. And the use of glue may be done. For easy visualization, during the removal of the foreign body, the pinna of the adults and children should always be pulled superiorly and posteriorly, and those of infants pulled downward and out. So for mechanical extraction, it involves the removal of oral foreign body by use of forceps. Patient is comfortably seated. A physical examination is done, and then a bayonet forceps or alligator forceps is introduced into the ear through an otoscope, and the forceps is advanced slowly into the ear canal until the foreign body is grasped and slowly withdrawn. Always check for complete removal of the oral foreign body and assess for any trauma to the ear canal after removal. Irrigation is the removal of the foreign body by flushing the ear canal with fluid. So a 20 gauge angio catheter is attached to a 60 ml syringe of warmed irrigation fluid. The patient is draped and an immerses basin is placed under the affected ear. The flexible tip of this angio catheter is gently placed in the ear, and then this irrigation fluid slowly is injected into the ear canal until the foreign body flushes out. I remember I have ever experienced this when in my teen years I introduced feathers in my ear and the tip got stuck, and I had to go through this irrigation. Even though it's not painful, it may cause some discomfort, but warm water is used and it has a soothing effect as well. Always conduct a post-procedural examination to assess for trauma to the ear. Suctioning is the removal of the foreign body by creating a negative pressure in the ear canal, and a soft tip suction catheter is used. This is connected to a low wall suction to visualize the foreign body with an otoscope while retracting its lens to one side, and then the catheter is introduced through the otoscope, gently advanced until the foreign body is contacted, and gently withdraw back the suction tip, and the foreign body comes out externally through the auditory canal. Again, a post-procedural ear examination is done to ensure the foreign body is wholly out or no trauma has been caused to the ear. Preoperatively, I believe we've had a lot of discussions on preoperative management of patient before ear surgeries or procedures. The anxiety of the patient should be allayed. Analgesics may be given to manage pain as prescribed, and sedation may be necessary if compliance is a problem on the part of the patient. The patient's vital signs are checked and recorded, and positioning of draping of the patient is important. Ear examination should be performed, and the procedure should be explained to the client. Post-operatively, clients would have ear examination performed, and we also check and record vital signs. The procedure, or it is explained to patients or clients that he or she should avoid inserting any object into the ears. And then in children, the parents should be instructed to report to the hospital if there's any bleeding, pain, or dizziness. Complications or post-procedural complications may include perforation of the tympanic membrane, infections of the ear, canal abrasions, and then bleeding from the ear. Second topic is tumor of the ear. Ear tumor can be benign, as in glomus tumor, or malignant, as in carcinoma. It can be located in the outer, middle, or inner ear, and students are to review the anatomy of the ear. And the signs and symptoms include, early signs and symptoms include deafness and tinnitus, changes in reflexes and pulsations. There may be bleeding from ear, either spontaneously or after cleaning. Dizziness or vertigo may occur, and then otorrhea due to secondary infection is also common. And clinical manifestations, other clinical manifestations include ear discharge with foul smelling and chronic otalgia. There's hearing loss, there may be facial paralysis, and then other cranial nerves may be involved, and it may spread in cases of cancers to associated lymphatic nodes. Then there may be facial palsy, and there may also be appearance of or increase in deafness or vertigo. Diagnosis is through physical examination and CT scan. MRI may also be done. CT scan and MRI are done to determine the extension of mass or extent, or how the mass has been extended. Biopsy for histological investigation is done, as well as general examination to exclude metastasis. Interventions include thorough assessments, comprehensive therapy according to type of tumor. We may have radiotherapy, surgery, chemotherapy. Refer to tumors in Nurs 234. Foreign bodies in the ear should be handled with care to prevent further damage to the ear. The care of patients with ear tumors depend on the treatment modality. Students are to review care of patients undergoing radiotherapy and chemotherapy from Nurs 234. And it is important for students to care for patients with ear problems to gain further skills in this area. So as references, students are required to read the following books for further reading as regards trauma, and then tumor, and then foreign body of the ear.